Ashish, as far as you're concerned, you say that vaccine is not the solution to COVID-19. You say it is testing. What's behind this view?
No, I've never said vaccine is not the solution. I think vaccine is absolutely the solution. The problem is vaccine is 12 to 18 months away. And so presumably we want to do something between now and then. And so the best way to open up our economy in the U.S., what we have seen in Singapore, in South Korea, elsewhere, is a very extensive testing, tracing, isolation strategy that allows the economy to stay open. But none of that takes away from the value of the vaccine, which is really fundamental, but unfortunately not around the corner.
The question
Ashish,
really is, as you reopen, how do you stay open?
And tell me something, if we are, what needs to be done next?
So, I'm sorry, the question was, are we getting over the worst of it? And I would say in Western Europe and in the United States, we are getting over the worst of that first wave. Not all the countries and not all of the U.S., but I would say New York is getting over the worst of it. And in the next 3-4 weeks, we will see substantially lower cases. There will be other parts of the U.S. in the worst of it in a few weeks. But certainly by the end of May into June, I expect the U.S. and Western Europe to emerge in reasonably good shape from this first wave. But the problem is that the virus isn't going away until we have a vaccine or until so much of the world has been infected that everybody has immunity. And as I said, that's not 12, it's at least 12 to 18 months away. So we will continue to have to deal with this virus into the summer, into the fall, into the winter.
So, Ashish, you're saying we're going to have wave on this, and if we've had it, you're okay. But there's been some limited evidence, hasn't there, that you can be reinfected? What do you know about that? But I'm interested in what you're saying, that we could be fighting this for ages, and also that, do you have any evidence of further mutation?
Right. So there are 3 or 4 notions there. So let me take each of them. So it will come in waves. There is, again, it's just basic biology that when you do lockdowns, you slow down the virus. And when you do aggressive testing and isolation, you can also keep the level of transmission in the community to a minimum because you're taking out the infected people from community and separating them and isolating them. So that's how you keep things going reasonably well. But what we've seen in almost every place that has tried that is you still get these waves, these little bumps, and you have to deal with that. As I said, unfortunately, there is no way through this until we have a vaccine. And it is possible that we could have one as early as 12 months from now, one that's effective and widely available. But other than that, we're going to be dealing with this. In terms of the issue of mutation, I'm not particularly worried about it. Certainly not one that would somehow inhibit the development of a vaccine. And one of the more interesting things is that viruses tend to mutate towards becoming less lethal. Now, not always, but usually that's how they do it. And so if there are substantial mutations that make this virus less lethal, I think that would be great. We'll take that. But we'll see where that goes.
Ashish, some countries are looking to reopen the economies, including the U.S., some parts of the U.S. at least. I mean, the question really is, how do you reopen and stay open? What measures need to be implemented to ensure that?
Yeah, it's a great question. And I think you asked the question correctly. Not just what do you need to open, but what do you need to do to also then stay open? And there are 3 main criteria that all of us who study and think about these things really use. One is you want to see a sustained period of declining cases. And so you know that the transmission in the community is heading in the right direction. Second is you want to have a very substantial testing, tracing, isolation infrastructure, because as soon as you open, the transmissions will start going up again, and you're going to then want to intervene with your testing strategy. And the third, you want to make sure your healthcare system is ready, because even if you do everything else perfectly, there is a chance that you'll get a large surge of cases and your healthcare system will have to take care of very sick patients. So it's really that 3-pronged strategy. If your healthcare is ready, your testing is ready, and you're seeing declining cases, you can open up very carefully and monitor the situation.